And as soon as I get right in front of the car, it decides, oh, I'm gonna turn now. And then it like clips me as I'm trying to get out of the way. And then I fly off the bike and I land head first in the pavement. Yeah, and then so I cracked my head. Hey guys, welcome back to TC Tea Time! Yay! Yes, we've got our very good crew again. Shiori, Ian, Judy, and me, Shizuka. Yay! And today we're going to be talking about healthcare in Japan.
I don't know, I thought I should join for some reason.
Thank you for always supporting me in all of my weirdness.
Healthy voice,
Healthy voice, yes. But healthcare in Japan is known to be, I think, quite good. We have a very good mostly public healthcare system. So it's interesting because you have lived in the US before, so you have plenty to compare. I am from Canada, so it's relatively similar. And it'd be nice to hear like what you guys thought, or what did you think of healthcare?
I was going to say, where am I from?
No, I know where you're from. You're from the UK.
It's the healthcare in Japan is, in a lot of ways, it's similar. In the UK, we have NHS, National Health Service, so which gets a lot. People are either love it or hate it. I think it's brilliant. I think it's a really, really good thing, and it will always treat the patient before looking at costs and things like that. It's all about healthcare. Japan, in some regards, is very, very similar to it, but there are differences as well. In Japan, I guess because we're all full-time employees in Japan, we're all enrolled in.
I'm not.
Because 3 of us are full-time employees in Japan, we're all enrolled in what's it called? National Healthcare Program. I always forget the Nihongo there. Kenko Hoken. Yeah, so you'll get enrolled in a national healthcare program. It used to be optional for a non-Japanese person living in Japan. When you came over, you could have private health insurance.
Really?
You could say, in England, if you're in Japan for over 30 days, I think it's 30 or 90, sorry, but if you're staying here basically, then you have to be enrolled in the national healthcare program.
Even though it's tourist?
No, I don't think so. So that's why I thought it must be 90, not 30. It's 3 months. So I'm pretty sure it's 90. So if you're here longer than a tourist visa, you have to be enrolled in the Japanese. Before you could, I remember you used to be able to put, no, I've already got health insurance. I've got private health insurance. I think the problem is a lot of people lied about that. And then just say, I've got, because they didn't want to pay the other one. And then it turns out they didn't, and then caused a lot of problems. Yeah. But now legally you have to. There's no way about it.
Oh, interesting.
So,
is it like different prices for foreign people and Japanese? I can't imagine it would be.
Don't think so.
That would be a little bit discriminatory.
It's based upon your income.
Yeah.
Right. Okay.
So
and age, it seems like.
Age as well.
So it breaks down from 10, 20, 30% of how much you pay, right? From your income.
No, I think it's always.
I'm sorry, what you meant is how much you will pay at the hospital?
Oh, taken out of your income.
No, I think it's around 9 or 10%. Generally, if you're in full-time work. I think what changes as you get older is the percentage you have to pay when you arrive at the hospital. Because for most people, working, you pay around 9 or 10. I think it's 9.1%. And that gets deducted automatically from your paycheck. And then if you need any medical treatment, if you need to get medicine, you need to go to the hospital, see a doctor, you can go straight there, whatever. You show them your card, your employee. If you're enrolled in the program, you'll get a little card with your number on it. And you will pay there and then 30% of any medical costs.
Up to 30%, that's what Jury told.
And then if you're older, I guess when you're when you become older, like in your 60s, 70s, that amount probably goes down, right?
Older than 70, 70 I guess.
Wasn't it like 2% that they pay? Or wait, that's a very small amount.
20%.
25, something like that it goes down.
So they pay a very small, like much less when they're older, which makes sense because they're not working anymore. So
the one, I guess the biggest, from my own personal experiences, I've got a lot of medical treatment in Japan. I keep hurting myself. I've had 3 MRI scans in the last couple of years, mainly through basketball and football and just falling over.
no.
But that's a good comparison actually, because in the UK, the NHS, like I said, it's very good in some ways, but one of the main complaints people have is if you need a procedure, or if you need some kind of operation, or you need an MRI scan or something like that, something that can't be done there and then in the GP's office, the waits can be quite long.
Right.
So a lot of people go for private just because. Now, often in the UK, the NHS doctors and the private doctors are actually the same doctor. Like they can be enrolled on both. The National Health NHS service, I guess. So often you're seeing the same doctor, but one you can pay thousands of pounds to go see. One's free, but you have to wait a long time. Just a quick example, my MRI scans, because I had one recently. Actually, it's in the video. It was a TC video. We played basketball, and then I just.
You would hit the head?
No. I heard like a pop and a slap, and my leg just stopped working, and I tore something down there. But
that's why you showed up here once in crutches.
That's it. Yeah, that's right. But,
all comes together now.
But
But when you were freaking out, but you were so calm, right? Because you get used to see doctors.
Yeah.
4 years later, one with the
half
day.
of the course, yeah. Same again. I'm on first name basis with my doctor at Sendagaya International Clinic. But just to give you an idea of how efficient it is. So I hurt my leg. I knew it was pretty bad. Got in a taxi, went straight to this hospital. I go to.
Is it a public one?
It's a private. Well, no. So this is the thing. If you're looking for a doctor's office or anything, it's really good to find one that, because all the ones that speak English, you have private ones that don't take national health insurance, and you have ones that do take it. So it's important to find one that does take it. Well, unless you want to play private, because in Japan you can still pay.
Yeah.
There are some doctors' offices, although you're enrolled in the in the healthcare program, you can still enroll in a private clinic that doesn't take it. So you don't have a choice. You're a member of it regardless, but you can still pay more to see an English-speaking doctor who's very specialized. Maybe the equipment's a bit newer and things like that.
Of course.
I see.
But in my case, recently, if anyone is moving to Tokyo and looking for a very, very good doctor's clinic, I highly recommend this one, the Sendagaya International Clinic.
We're advertising hospitals.
Are we allowed to do that? It might be helpful for someone.
I'm pretty sure you
I've
can.
got no affiliate program with them. I just think they're very, very good. But they're all Japanese doctors. They all speak really good English, but they do take the national health care, and you can generally just turn up without an appointment if you hurt yourself like this. And it's really good. Central Tokyo.
Oh, that's great.
But I went there, hobbled in. He could see I was hurt. And he was like, right, that looks like your Achilles problem and all this. And he said, so you need an MRI scan. And he booked me in for the next day. And then 2 days later, I was back at the hospital with him, with my MRI results, looking at it. And that whole thing from start to finish cost me $80, including the MRI scan.
Oh,
Wow,
that's
that's so cheap.
In the States,
In the States would be
a couple of $1,000s.
Yeah, a
at
couple of
least.
thousand. I
Yeah.
mean, getting on the ambulance is $800 base. Right?
Yeah. Wow.
And
Whoa.
here I think it's way cheaper than
It's
that, right?
way cheaper. And
Yeah.
I should know this because I've been in an ambulance 4 times
What?
since coming to Japan.
See, I've never been in an ambulance.
Really?
How did you do that?
I've been in an ambulance 4 times. Various accidents that I've had in the years.
What's wrong with you
Yeah.
guys?
I don't know.
Okay.
I never had to ride in an ambulance in Canada ever, but I've been in Japan for 9 years, and I
Do they charge you
consistently get
here
hurt.
for the ambulance?
I think they might. I think the ambulance itself might be free.
Oh, that's
Okay.
not
True.
very affordable.
It's
Okay.
very, very affordable.
Yeah, it won't break your bank.
Let's research and
When
put the
I
information.
can't remember exactly what it was, but your hospital say like emergency fees. I think there's a little bit that you have to pay.
Mhm.
But it was still super affordable. Like even when I paid for it, it really wasn't that much.
Yeah.
So that's why many people, if they get a small injury, or even if they just feel a little bit, unwell, and it's gonna take a long time to get to the hospital, then they just call the ambulance.
But that became the issue though
Yes.
in Japan, right?
Yes.
Because a lot of people they are just lazy to get
Just like a
to
taxi.
the
Or like I hear when people are way too hungover or too drunk, and they can't they're not unconscious, but like they need tentiki.
Yes.
Say alcohol too.
Yeah.
What do you?
Alcohol
what do you say?
poisoning.
Alcohol
They
poisoning.
got alcohol poisoning, just call the ambulance, and then it was like 500 yen or something like that.
What?
And then get
That's
treated.
so cheap.
Yeah, whereas like in the US, it'll be like, I think at least $1,000.
Yeah,
Yeah.
I'm sure it would be.
Yeah.
But this has been a problem because
Yeah.
people will use it for convenience sake, and also you can avoid wait times at the hospital if you take the ambulance, because you're technically going in as an emergency. If you tell them it's possibly very serious, then you can go by ambulance. But in some ways, it's a really good thing because if it's in the U.S., like people who actually need an ambulance sometimes actually opt to not take the ambulance because they don't have the money.
Yeah.
Like they actually broke their leg and they'll like try and they'll try and find another way to the hospital.
Yeah.
That's the other side of the problem.
Like Japanese people, just sometimes they consider that the real emergency people who actually need ambulance, just because the stupid drunk people needs the ambulance,
Right.
then it's occupied already.
Yeah.
So there is no one. The car, the ambulance need for the people.
Yeah.
So we are like, sometimes I'm not sure how much this information is accurate or not, but they're asking you how serious you are sometimes over the phone. Because if you have conscious and if you can talk, maybe could you try to come to the hospital by yourself? They actually ask. But I think the hospital side is also need to be careful because
they can't take in everyone.
And also
But it's a risk, like maybe you can still talk and you're fine, but what if something did happen where they just lost consciousness, and then that would be their fault.
I guess one thing Japan does quite well as well, it can be very, very confusing if you're new to Japan, but they kind of split up their medical services more. In the UK, if you've got something, unless it's an emergency, you go to the ER, like the accident and emergency area in the hospital. But if it's just a general thing, the first thing you do is go and see what we call a GP.
Yes.
Did you get it?
Physician?
Practitioner. Which is a fancy way of saying doctor.
Wow.
And he has a look at you and he kind of says, okay, you got this wrong, you should see a specialist in this. And but he or she knows a lot about general things, hence the
Naika.
Yeah.
Oh, they have here as well. But I was going to say in Japan though, they have like very specific ear, nose, and throat doctors, and you have if you have something like the flu or something, you go and see, or if you have
sinus problems,
like tonsil problems, you go and see them rather than. So I found that in Japan it's more split up from the beginning, like you
very specialized.
Yeah, very specialized. You don't. I guess you do have GPs by the time, but people would. Like I said, when I had tonsil problems a long time ago, my friend took me to the ear, nose and throat doctor rather than going via the GP first.
Right. Yeah, that's very common. That was kind of confusing for me when I first came to Japan, though, because I didn't know what also, sometimes when I don't feel well, I don't know what's wrong with me. So I don't know which specialization of medicine I should go to.
That's true.
And I didn't really know what Naika was either. Like Naika is kind of similar to the GP. It's internal medicine. So you could go there if you have a cold. I think you can also go there to just get blood tests or general things. But I also don't really know. So I think if you're not sure, you might as well try the Naika.
Because if you go to see doctor, you don't want to waste your time, right? So for Japanese, it's like you want to straight up to the point. You need to be shown, eh?
What? What are you
need to show? Okay.
What are you showing?
I think the fact that I understood everything she meant means we work way too close with each other. But yeah.
Translate.
You
don't know.
No, I was just trying to remember what you said. If you want to go to you don't have to like show what the symptoms are like or things. So if you because
for example, now the hay fever season. So Jibika, which is hana, nose and the ear. Hospitals are super sometimes long line because everyone is like hay fever. I don't know why, but a lot of people having the trouble with pollen. And then I noticed that if you go to pharmacy by yourself to get the medicine from the medical company.
From the pharmacist?
No pharmacist.
Like a prescription? Like from your doctor?
Without that. It just the
over the counter?
Over the counter.
From the drugstore.
Drugstore.
Well, that's one thing in Japan. You can't generally buy medicines in supermarkets and things like that. Maybe even like headache tablets, you can't get them from the convenience stores. You have to go to an actual drugstore. There's a chain we always talk about, Don Quixote on Tokyo Radio. There's even those, they have the areas, but you have to buy, if you're buying headache tablets, you can't buy it at the regular counter at Don Quixote. You have to wait for they'll call the physician down, or someone qualified to sell. To sell you it.
There's the rank, the Daiichi medicine. You need to have the pharmacist.
To get it.
Second, third level, the person who has the license can doesn't have to be the pharmacist. Also can sell. And then, but why I wanted to say was it's much more expensive if you go to buy the medicine in the box. Okay, it's not a prescription.
Over the
counter.
Yeah. You only have to pay like 30%, right?
It's so expensive.
No. In the pharmacy, you pay 30% if you go to see the doctor or hospital. Oh, so you're saying the cheaper one is but if you go to the pharmacy, it's like the branded ones are really expensive.
It's like double, triple the price, I guess.
Well, you told me the other day when I went to buy, because I'm only really suffering from hay fever for the first time this year, and I went and bought the one you recommended. Was it whatever one it was? But it was like $20 for 10 tablets.
Yeah. What?
Yeah.
2,000 yo.
That's so expensive.
But if you are struggling this hay fever every day, it lasts like 2 months, 3 months. It ended up being like $300 or like that. So that's why the people go to see doctor to get
cheaper medicine.
Yeah, cheaper medicine, which is a
prescription.
Yes.
And that makes sense. That also kind of makes it clear why everyone also goes to the doctor when they have a cold. Because I always was really surprised at how as soon as a Japanese person catches a cold, they go straight to the doctor. Like pretty much every Japanese person I know. And from me growing up in Canada, if you have a cold, it's not a big deal. You just suck it up and you like
in England they tell you to stay at home because it's a waste of the doctor's time and you can get other people sick in there and they can't cure the
and also
cold.
the medicine you buy from the drugstore is enough, right, for you guys, I guess.
It's quite strong,
right?
Drugstore medicine is pretty strong,
but I think in Japan it's hard to get the very not strong, contains the amount of the medicine.
It's different. Well, I'm not sure about like tablets. Like the headache tablets I take in Japan whenever I have always worked for me.
Me too.
But I can, sorry, this is a little bit gross, but local anesthetic, like if you're having like a minor, basically I ran into a wall and I got a big cut across here.
Oh my god, what is happening?
I did that too though, but don't tell me you stitched it up yourself.
No,
That's
I didn't
crazy.
do that.
Okay.
No, I didn't do that.
I thought you like purchased some local anesthetic and it just sewed it up.
It might have been rum, I'm not sure. But no, I went to the hospital and they gave me like a local anesthetic and then he stitched me up. And I could feel every single, it wasn't numb.
Yeah.
And he did it a couple of times. Like I said, I can still feel it. I mean, it wasn't like super painful, but you can feel it still. So that's when I realized, and I kind of after that, I Googled it, and there was a lot of people who say like, for local anesthetics and stuff, it's not as strong in Japan as other countries.
I see. Really?
Don't run into any walls in Japan.
Man, I wish I knew that sooner. But I didn't need any stitches. Oh. Yeah. So as I mentioned earlier, I've had a couple of accidents.
Yeah.
The first time I ever rode on an ambulance, I got hit by a car, which was pretty exciting.
Scary. Exciting to say the least.
You okay?
Yeah. Totally fine. I was riding a bicycle without a helmet. Which is also a thing in Japan. Nobody wears helmets in Japan. So I was kind of doing the same thing. And I was in my neighborhood, so I didn't think that anything would ever happen. But I collided with a car collided with me. I was going down a hill and then for some reason the car didn't see me. it was like gonna turn out this way, but it was taking a long time to do that. So I was coming down the hill and it was still stopped. So I thought, okay, I can keep going because it's waiting for me. And as soon as I get right in front of the car, it decides, oh, I'm gonna turn now. And then it like clips me as I'm trying to get out of the way. And then I fly off the bike and I land headfirst in the pavement. Yeah, and then so I cracked my head. Luckily, no skull damage or anything.
You actually
I cut open
your head?
I didn't crack the skull, luckily, but I cut open my head.
And stuff
yeah, but I kind of like when I landed on the ground, I was like, oh no, I've done it, and I didn't even open my eyes. But apparently there was a lot of blood. I didn't see what it looked like.
Wow.
And then of course someone called the ambulance, and then I headed straight to the hospital. But what I really wanted to see though was that since it was technically a crime scene, they like circled the blood in like chalk. Like, you know how they do?
Is there an outline of you as like flying?
Yeah.
And I never got to see it, and I'm so sad I never saw it because I had to stay in the hospital for a little while. But there was the outline of chalk.
That's
of my
the one thing you regret and take away from this accident.
Yes, I never saw the circled. Yeah. But the thing from that too was that the whole, even though I stayed in the hospital for like a week, but it was still pretty affordable. But of course, insurance companies and the other person who hit me was covering that, so I didn't need to really pay anything, which was good. But then the times after that, it was more, I was encouraged to take the ambulance. Like even though I didn't think it was a big deal, they usually say, yeah, it's better just take the ambulance just in case. So that's why I've ridden ambulances more often than I ever thought. One time I fell down the stairs, kind of like you did, and then I hit my head in the wall, and the wall.
Why?
So many accidents.
Maybe that's why you are sometimes too happy.
Maybe. Sometimes a little bit too happy. It's actually head. Yeah, I've had some head trauma.
But
that's insane.
Yes.
You
I
always
was
fall
totally
down
fine.
from somewhere. I noticed. Why?
I don't. It doesn't happen that often. I think it was just that one
or
time.
Two.
Okay.
One or two. Not too often.
Dizzy or something?
I had a good shake up when I hit that wall. It was a nice, like, almost cement-looking wall.
That's nice. At least it was a pleasant-looking wall when you did it.
And I dented it with my head. Just.
Wow.
But so I like kind of I got a little cut on my forehead, and
Did you
I
have
was
to have stitches or anything?
luckily I think my forehead I didn't need a stitch up. I had one little stitch in my leg.
Okay, because when I guess that's one thing about using the Japanese, that if you use the basic program, which most people are signed up for, you can apparently pay more and do another, or you can take out some extra private insurance as well. But if you take out the basic one, you might not always be able to use the most modern treatment and things like that. That's one thing about it. It's kind of, you use the standard hospitals. A lot of the, because I remember when I first cut my chin open, I asked, because a friend of mine had a similar injury, and they can kind of like glue it almost. They use like this glue in it and let it heal. And he was like, yeah, sorry, I'm not on your plan. I'm going to have to go in with the needle. Yeah.
The glue is the more advanced one?
Yeah, apparently so.
That's not fair. What?
But in your experience though, has it always been in Japan, like from a speed perspective? It's always been super efficient? Because I've never heard anyone in Japan complain about how long it takes to get seen or to get treatment. It's actually the opposite. Anyone I know who's had any medical treatment, it's always been super fast, super efficient. Where I think that's maybe the biggest difference I'm used to, because I know in England, if you need if you're having an operation, like a knee operation or something like that, and as some of my friends have had, it's normally you expect for a couple of months wait or something like that. It's kind of part of the process. Yeah, where in Japan it's kind of, they snap into action. It's like, okay, you need this done.
Doctors actually like to make it short because doctors get paid by how many appointments they get in. So it's in Japan at least. So that's why people are really efficient, and you know, they want they want to see as many people as possible.
Oh, really?
Yeah.
Well, I went to see a doctor when I had the influenza for the first time. Actually, this last January. January 3rd. And then
that day when I was diagnosed.
diagnosed with the flu.
January 1st, 2nd, 3rd is usually everything's off.
Yeah.
So the next day is open for the first time for the year.
Yeah.
So I went to hospital, like I waited like 4 hours to get to see the doctor. It's at the GP. GP doctor.
So it can be.
It can be.
a bit
And then,
away, okay.
but he was so efficient. The moment he saw me,
Say,
it's so obvious you are influenza. And then in Japan, if you are influenza, you need to stick your nose.
I hate that.
Chung, chung, chung.
It hurts.
Why do they do that?
They check your.
They stick they stick like a long Q-tip up your nose.
That's why I'm
into your brain. It's
No, it's not. I don't think so.
it doesn't go in your brain. It goes so deep that when they do it to you, you're just like, what? What are you doing to my face?
And then you have to stay like this for a while too.
Oh, really?
Oh, it's so uncomfortable.
Well, luckily I didn't need to because it's so obvious, he said.
They never even warned me they were gonna do it. One time I went in because I had a very, very bad cold. And I'm like, we'll just do a check. And they just they stick it up. I'm like, what? That's a violation.
So maybe the Japanese hospitals are sometimes too old, I guess.
Yeah.
Maybe.
Well, one thing kind of linked to that, just before we wrap up, is as part of that, you're paying for healthcare, you have to be enrolled in the system. One thing that's to do that is that you have to, if you're in full-time employment, you have to have a health check once a year. Whereas in England you don't. You do that yourself. I don't know about other countries, but in Japan it's mandatory. It's
which is great, I think.
Which is good because I know once you hit after 50, you have to get like the camera down the throat thing. They really kind of thing. And
terrible.
In Japan, it's kind of fun, right? Because you go to the hospital, put on the gown. I hate blood tests apart from that part, but the rest of it's kind of fun. You go from like little different station to station to station. One you'll like gargle something and then they'll check it. And then the other one, I recently had to do when you're standing this thing and they like spin you around and they check your stomach and stuff like that, an x-ray of it.
Valium?
You drink Valium and then you kind of like get spun around. But it's kind of cool because except for the blood test part, it's all kind of little fun things, but it's good because they're really good at picking up any potential things. And the only thing that some people don't really agree with is they send a copy of your report. They give you a grade, right? You always get A every year. You told me your health check. They measure your height, they measure your weight, they do things.
The weight they're very strict.
If you're overweight,
that.
your company will get told you're overweight.
Yeah.
And then you might get called into the HR office and like, look, fatty. You need to,
they're actually so strict on that though, like in Japanese standards, right?
Yes.
They do that.
Yes.
So you might not necessarily be overweight.
Yeah, exactly. But it's good that you actually mandatorily have to go and get yourself checked because, a lot of people don't like going to the doctor. I hate going to the doctor. But doing it that way, at least if there are any potential problems, you'll know about it straight away rather than letting it get too bad.
Very true. I think, all in all, Japan has a very good system in place. They make sure that everyone is systematically checked. They also really encourage checks for cancer, cancer screenings at different ages and things like that.
And I also found out there's 2 months before the health check every year. People what's it called as a word for it? They for 2 months they eat super healthy. They kind of just so they get a good grade for their company. Then they go back to 10 months. But it's a thing, right? It's a 2 months of trying to get in shape and just eating clean and stopping alcohol for a little while.
Just to get good score.
Just get good score.
Exactly. That's true. But
is that why you get A every year?
Yeah.
How was that? We've been together for a year.
You drink.
I drink every day.
You drink every day,
but not like. Right.
Wow. She is a small tank. But anyway, that about concludes our topic on healthcare in Japan. I think all in all, it's a good system, and everyone is benefiting quite well from it.
And they also, I think we can talk about more specific health topic, but we just talk about everything like general.
Very
general.
But this has been a very good learning experience for me because I don't know a lot of these things, to be honest. Moving back here.
Right.
Yeah.
And there's plenty of people out there who are planning to move to Japan, and it's kind of an overwhelming experience at first. So it's good to know that there's always specializations for different doctors. It's good to know what are the more common ones to go to. Generally, if you're in doubt, the NICA is a good one to visit, the internal medicine doctor, and they'll pass you on to other doctors after that if you need to. So yeah, I hope you guys learned something from this video. And if you have any more questions about healthcare or the medical system in Japan, let us know and maybe we can discuss that further in another video. Anyway, thank you guys so much for joining us.
Hi.
And see you guys in the next video.
Bye.
Bye.